Hey everyone, it's Dr. Rick, founder of Herbal 411 and Dr. Rick Hiking Excursions over on Facebook. So my quick video today is about what to do in case you have development of stuffy nose, headache, watery or red eyes, and body aches or cough. In the last couple of weeks, we've had a surge in the Midwest as far as influenza, COVID, RSV, and walking pneumonia. And it's unusual that it's coming out all at the same time, but COVID is actually dying down and the variants nowadays are tolerable. Now, if you have medical problems, you might be at risk for bad outcomes, so please see your doctor. And this is not meant to be a medical advice substitute, so please take this information and bring it to your doctor's office for how it applies to you. The idea, though, if you have any of those symptoms, that you probably are infected. The question is, can we shorten it? Now, my patients who attend my virtual practice, I definitely get everybody to the point where they can shorten and get through the infection fast. Even with herbal medicines, and I've had a video several times where I talk about the use of herbal substitutes instead of medicines. But the question would be, which of the four do you have? RSV, COVID, influenza, or walking pneumonia? Because the treatment's all different. We'll start with COVID. Everybody knows there's Paxlovid. That's a medicine that was released about 2 years ago. And the data shows that it shortens the duration of the infection so that you don't spread it to everybody. But currently the variant now is so easy to get through. Now, if you have diabetes that's out of control, or you're on an immune suppressant medicine for psoriasis or rheumatologic disorder or lung disease, you have to be careful. But if you're not on any of that, you can consider Paxlovid. The only problem is there's a lot of side effects and it interacts with a lot of medicines. So please ask your doctor if you're one of my patients. I can call it in for you, just have to be careful. The treatment for Paxlovid or COVID is totally different than the treatment for influenza, which will be the next thing. And the reason I'm doing this is because if you're faced with a 2-hour wait or more at the emergency room, and I've heard some emergency rooms around Illinois are like 12 hours of waiting. If you're faced with that kind of waiting and you just want to get swabbed, you can actually buy a COVID and influenza swab kit at Walgreens. I just priced it out for, I think it was $30 or $20, but it is paid for by FSA or HSA in case you have that with your work. That's a health savings account or a flexible spending account, and it is a pretty accurate test. You can also go to an immediate care center if you're one of my patients. Just let me know and I'll fax over the order, or your doctor might be able to fax over an order like I did with a patient. Patient had symptoms and I said, well, the treatment plan is dependent on which of the four you have. So I had them do at Northwestern, had them do a influenza swab, and look at that, positive for influenza. Number one, patient walked in, gave my order, had the swab done within about 15 minutes and had a positive test. So they were out in 15 minutes. And then they called me and then I said, okay, positive, let's go ahead and send the Tamiflu over to pharmacy that was across the street. I called the pharmacist, I got the medications, they said it'd be ready half hour. In and out from swab to deployment of medicine in 40 minutes. That's pretty decent compared to trying to get an appointment with your doctor, trying to go to an immediate care center or emergency room, then going to the pharmacy and having to wait if it's electronically sent over. So this is the beauty of my practice. But let's move forward. Now there's also RSV. RSV is respiratory syncytial virus. It's not really a great treatment unless you have very bad disease, or if you're a baby, then you might have to have antibodies. If it's RSV though, then at least you know what to be careful with as far as spread, and also you can shorten duration of your suffering. So regardless, the RSV, they don't really have a swab that's over the counter. It's just COVID and influenza. So you can kind of narrow it down, at least with the two, on your own if you're one of my patients. The final thing would be if you don't have influenza and you don't have COVID and you probably don't have RSV, then what are you left with? Walking pneumonia or mycoplasma pneumonia, atypical pneumonia. And you don't necessarily have to have any fullness or phlegm. That bacteria, mycoplasma, can also be in your nose, sometimes in your throat, sinuses too. But bottom line is that when you have that bacteria, if you don't have COVID, if you don't have influenza, if you don't have RSV, got my tests done, everything's negative, now what? well, let's get you treated. And I typically will go with Zithromax or Z-Pak. The problem is if your immune system is terrible, what are you going to do after the 5th day, the 6th, 7th, 8th, 9th, and 10th day? You have to depend on your immune system to kick in and take care of the rest of those bacterial or viral particles. So it's important to sleep. So I give sleep medicine as far as cough, promethazine or robitussin with codeine. It's also important to open up the nasal passage. I like Atrovent nasal spray. I think it's more aggressive than Flonase twice a day. If you have glaucoma, then you can't use that inhaler or nasal spray. And then comes the inhalers. If you have an asthma issue, prednisone might be important. If you're totally stuffed up, definitely prednisone for your nose. And then the inhalers for your breathing. So it's important to do all this stuff. Body aches, I kind of play it by ear, and if you can't sleep, then we might deploy something for inflammation. And the prednisone does that, but an anti-inflammatory can do it too, prescription or over the counter. But all these things are a jumbling of different control systems to shorten the duration of your suffering. So just like exercise, if I can shorten your inflammation and your pain, then you can get back to exercise and continue building a healthy lifestyle. If we can control the inflammation in your lungs, in your nose, in your head, in your joints, then you can get back to living life properly and interacting with everybody, and you'll not spread it as much. So those are the reasons why I'd say it's sometimes important to work with your provider instead of waiting in an emergency room or immediate care center, or for your provider to open up a visit in a couple days. You do have the power to make this shorter. So hopefully this gives you a couple of ideas. If you're one of my patients, you can send me a message to get healthy, especially if you're sick, and we can shorten it up. The idea is to get you back to functionality and not take so much PTO or time off or sick leave, and hopefully not infect everybody else in your family, because if you're a parent and you kind of muscle your way through, but you infect your kids, you're going to have to stay home, not only for you, but in about a week for your kids to watch over them. So we just want to stop it in its tracks, get healthy, and hopefully get through this winter into spring so that you can build up a healthy immune system and not have this next year. So hopefully this gives you a couple of ideas. If you have any questions on your ways that you avoid getting sick and or getting through the long line in the immediate care centers or the emergency rooms, please put them in the comments down below. Otherwise, consider subscribing and liking the video, and I'll see you in the next one.